Hello everyone, so today we are talking about vitiligo. Now what happens mainly in the disease vitiligo is that there is a focal loss of your melanocytes that results in development of circumscribed patches of hypopigmentation. So basically what do we get to see is hypopigmentation in case of vitiligo. Now vitiligo can be classified into two types, that is your localized and generalized. When we talk about localized, in that mainly you have your focal vitiligo, segmental vitiligo, mucosal vitiligo. Okay, so these are the three types of vitiligo that we get to see in case of localized. When we talk about generalized, we have acrofacial vitiligo vulgaris, lip tip vitiligo and mixed vitiligo. So this is your classification for vitiligo. Now coming on to next, we have what are the clinical features that we get to see in vitiligo. Clinical features, it can be divided into three types based on the classification. So you have non-segmental, segmental and lastly your trichome vitiligo. Now when we talk about non-segmental, it is basically that you get to see small depigmented macule which is often symmetrical. It occurs mainly around your body orifices, and in this you have your hair, beard, eyebrow, lashes that results in depigmentation. Okay, and the patient becomes very susceptible to sunburn. Now when we talk about segmental vitiligo, in this basically it is restricted to one part of the body, and patches of depigmentation, they're sharply defined, which is a important characteristic feature of this. Okay, and sensation in the depigmented patches continues to remain normal. Now when we talk about trichome vitiligo, there is presence of tan colored zone that is present in between your normal skin and the depigmented macule. Okay, so this is your clinical features. Now coming on to the last part of vitiligo, that is your management. Now what do you have to do in management is basically you need to protect the patches from excessive sunburn. Okay, and you need to prevent yourself by applying sunscreen, or you need to cover your body with clothing so that the sun exposure remains minimal as possible. For treatment, even though it is not satisfactory, yet what are the available options? You can go for topical corticosteroids, topical immunomodulators, phototherapy, and in surgery you have your punch grafting. Thank you for watching.